Hey everyone, welcome back. Today, we're diving into a serious issue that's affecting healthcare professionals across the United States. Yeah, we're talking about the rise in transgender healthcare bans and the staggering impact it's having on clinicians treating trans minors. So, why are we seeing this surge in demand, and what's the deal with these legal threats? Let's break it down. First off, clinicians like Dr. Cade Goepford at Children's Minnesota Hospital are on the front lines. They've seen a whopping 30% rise in calls from transgender youth seeking treatment. That's led to a year-long waiting list for new patients. Imagine being a young person, waiting a whole year just to see a doctor. And the reason? Bans on gender-affirming care for minors in 26 states. These families are often forced to travel across state lines just to get the care their kids need. It's heartbreaking. But it's not just about the numbers. These clinicians are facing serious legal risks, and get this, death threats. Transphobic attacks are on the rise, making an already tough job even harder. Despite these challenges, these healthcare providers are sticking to their guns, committed to offering essential care to transgender youth. But the increased demand, along with the legal and safety concerns, is creating a stressful and potentially dangerous environment. Moving on to Florida. A federal appeals court recently upheld the state's ban on gender-affirming care for minors. This means transgender youth in Florida can no longer access puberty blockers and hormone therapies, even with parental consent. This ruling is a big deal, and it's part of a larger trend across the U.S. At least 26 states have enacted similar legislation. These bans are facing legal challenges, but for now, Florida's law stands. The decision has sparked outrage among LGBTQ+ advocates and allies. They argue that the ban is discriminatory and harmful to transgender youth. Gender-affirming care is crucial for the mental health and well-being of transgender youth. Denying access can have severe consequences. And it's not just about the kids. The law extends to transgender adults as well. They now face additional barriers like in-person consent forms and limitations on telehealth consultations. Doctors who violate the ban could face hefty fines, imprisonment, and even the revocation of their medical license. This law has drawn sharp criticism for discriminating against transgender individuals. Critics argue it infringes on the rights of transgender youth and their families to access medically necessary care. And don't think this issue is going away anytime soon. The Supreme Court is set to hear a similar case from Tennessee in the upcoming term. This could potentially impact the landscape of transgender healthcare nationwide. So, what do we take away from all this? The rise in transgender healthcare bans is putting providers in the crosshairs, dealing with death threats, legal risks, and overwhelming demand. Clinicians are doing everything they can to care for these vulnerable patients, but the challenges they face are monumental. Thanks for tuning in, and don't forget to like and subscribe for more updates on critical issues like this one. Stay safe, everyone.